Record.
This meeting is being recorded.
So if you don't want to be recorded, please turn off your camera or put questions in the chat. As usual, you can always email us anytime at ccc@wakefield.gov.uk. So here's the agenda for today. We've got Steve Turnbull giving us an update on the data. We've got Darsha that will say a few words about the communications, involvement and equity work stream that she and I are both working on. I'm going to say a few words about the postcards from Wakefield, and we're going to finish with a grand finale by Asif about more money in your pocket. So we're finishing on a positive note. So without further ado, over to you, Steve.
Okay, thank you, Tracy. So if you just move on to the next slide, please. And this is just some information about the numbers, really. Because the free testing has ended, and we're still getting some data through what's called the ONS survey, the Office for National Statistics survey. That's once a week. But it's more important to just look at the trends in data rather than compare numbers now to numbers at a previous point. But as you can see on here, three charts from left to right: cases, positivity, and then testing numbers. And the general trend on all of those is it's all going down. So, which is really positive, particularly the left-hand chart. That's showing that we have come down from this last wave really well. And the last wave was Omicron, but it was a different type of Omicron to the first one we had. It was what's known as BA2. You might hear that being called. That is more than 9 out of 10 cases across the country. So that's dominated. There are other varieties of Omicron that are being watched. Very low numbers so far. They may cause some more smaller waves in the future. You may hear of BA3, BA4, and BA5, particularly BA4 and BA5 are ones just to watch that we're keeping an eye on. But actually, it doesn't look like they will change. They're not a game changer. They won't make any more severe disease, for example. It may just cause another ripple of infections at a later time. If you move to the next slide, please. And this will show how this is looking across different areas. You can see on the top right hand side of that chart, it's like a sad face, but it's actually a happy face because we've seen that we've gone up and we've come back down. Actually, the Yorkshire and Humber figures, that's showing that the percentage of people infected back a week or so ago was probably around 5% of the population. So 1 in 20 people would have been infected. That's come down off a high, and actually we think Wakefield might be a little bit lower than that. So yeah, absolutely, Gary. That is a classic case of turning the frown upside down, which is really good news, and you can see that's consistent across every part of the country. Yorkshire and Humber and the North East were a little bit behind other areas in going up the curve, so we're a little bit behind coming down. But you can see all the other areas have started to come down really well, and hopefully we'll continue to do that over the next few weeks as well. Next slide, please, Tracy. And this breaks down those figures in age ranges, and again, it's really positive. Every age range is starting to decrease. It tends to be the younger age ranges that pick up first, and then it passes into the older age groups, which is why we've got 50 pluses and 70 pluses a little bit higher than the rest. But we're hopeful that they're on the right trajectory now as well. So next slide, please. And this is just another way of describing this for Wakefield. You can see these are what we call heat maps. The darker the colour, the more cases we have in the age ranges, and you can see it's still lingering a little bit in the older age ranges, but actually it's all decreasing, which is good. And next slide, please. And that's just a subset of those data. And what this is testing in hospitals. So you can see the very dark line is because there's simply more people of an older age range in hospital. So it's a little bit of a skewed data to what we're used to presenting. But if we just move on from there, still showing the good story that everything's coming down. And you can see this is the journey for people in hospital bed with COVID. and you can see the different waves we've had. So the most recent one on the right hand side of the chart didn't quite reach the heights of the first Omicron wave, and definitely didn't reach the heights of the big waves that we had just over a year or so ago. But what you can see is we started to come down quite well, which is good. That's not to say the NHS is not under pressure. There's still a lot of pressure in the system, partly because of COVID, but partly because of other issues as well. Not to mention the number of bank holidays that we've had. But it sounds like we've done reasonably well at getting through those bank holidays. But things are going in the right direction in COVID inpatients, which is, again, another positive news. I'm not used to dealing with positive news all the time, so it's quite refreshing, really. If we move on to the next slide, please. Sadly, this is the chart that looks at our deaths, and we had a little blip, which is linked to the last wave, but still very low numbers, and we've come down even further. Hopefully, it won't be much longer until we have a period without any COVID deaths, and it's been a long time since we've had that, so that will be something to hopefully look forward to. But you can see we've had relatively small numbers. I mean, these are all people that have sadly lost their lives, so there's no such thing as a small number. But they're certainly not in the big numbers that we've had in the previous significant waves that you can see. Going back to 2020, 2 years ago, we've been doing this, and we're now getting to the stage where we are truly trying to live with it in a different way, which is all very positive. Next slide, please, which will just bring us on to vaccinations, which generally is a good picture. So you can see on the left-hand chart, slightly complicated chart this one, but on the left-hand chart, looking through age ranges and people who are more susceptible, you can see lots of green. As we get to the bottom part of the chart, there's some ambers and reds. Now, I wouldn't be overly concerned with this because some of this is more of an offer. So particularly for the 5 to 11-year-olds, the numbers are quite small. I've taken up the offer of a vaccine, but it's not been driven as much as the other ones, because the risk of COVID in somebody young is smaller. So it's the vaccine offer for 5 to 11s it's there. If parents and children want to take up that offer, it's there for them, but it's less of a drive to get people vaccinated. The real challenge with the vaccine program will be coming into we're in the spring boosters now, but when we come towards autumn and winter next year, we'll be wanting to look at and make sure people are up to date. But of course, if COVID has receded even further into the background, we may find some people not coming forward like they have done. So we really want that message to go forward. Is part of the reason why these waves are having less impact is because people have been vaccinated, and if we allow this to drop off, then we'll find waves having more impact. So we still need to keep the message that vaccines are really important. They are the second globally. They are the second best public health intervention we have. The first one is clean water. So they are that essentially in improving and protecting the health of the population. And I think that may well be the last slide, Tracy. So open to questions.
Thank you. We did have a question that I've sillily put right to the end of the slides. I'm not sure if you're staying with us for the whole session, Steve, or shall I whiz down to the end?
Yeah, if you don't mind, that'd be helpful.
Oh, actually, Darsha, I did send a copy of the question to Darsha. So, Darsha, would you have an answer for the question?
Is it the vaccination for children with autism? I have a partial question to say that some of the paediatric clinics are running at a slower pace with reasonable adjustments, and there are some that are being planned specifically around West Wakefield towards the end of May. But I want to find a precise information that I will then share following the meeting when I get it, if that's okay.
Yeah, thank you very much. My bad for putting the question at the end there, but the question came in, I think it was from an email to say, do you know any plans for children's vaccination appointments and drop-ins that would be suitable for children with autism or learning disabilities? So that was that question, Steve. Does anybody else have any more questions, different questions for Steve to respond to?
Just on that last point, though, I mean, Dash has mentioned that, but I think from what I've heard, the general 5 to 11 sessions are really being handled very, very gently, and some children didn't want to leave because they're having such a good time. So, so I think, yeah, that I think that would be, it's a very good question and a good one to go away and find some more information on. But generally, when you vaccinate in young children, you want to make the best effort to make it sure that it's a very friendly environment and a very nice environment.
Absolutely, and that's good feedback. If a child doesn't want to leave when they're having an injection, that's brilliant feedback. Thank you. Thanks very much, Steve. So now we've got Darsha, it's your turn here to tell us about the COVID pass, please.
Thank you. I'm just thinking that a child not wanting to leave a vaccination session is the best feedback that you can have, that no evaluation form will ever capture, will it? So that's lovely. It actually links to 5 to 11-year-olds, but this is in terms of the NHS COVID pass. So up until recently, we had the availability of the NHS COVID pass for older age groups, and this has now been extended to 5 to 11-year-olds, which may well be useful for those who are planning to travel abroad. It will have to be done by the person who has legal responsibility for the child, who can request it, and it can be either done online or via contacting the NHS line on 119. So that is just a summary, just to say it is available and how to request it. On the next slide, we've got a quick overview of, as you mentioned, Tracy, the word that we are all, including Kerry, involved in terms of the Wakefield place. So across Wakefield for our organisations, and as we go through changes to form the Wakefield District Health and Care Partnership, we've set up a communications involvement and equality group. So that brings all colleagues who work within communications involvement and equality together, and we look at all different aspects, all 3 aspects, and it is about how we work together. What we want to do, because we meet on a monthly basis around these 3 strands, we want to make sure that we reflect the user voice and community voice, general public. And really what we would love this group to let us know is, how do you feel we should best present it? How should we do it on a monthly meetings? In what format or what particular focus should we take? So it's an open question. We would love to hear from you. If you wouldn't mind dropping an email onto the COVID Committee Champions email address, that would be fantastic.
Thank you, Dash. And can I just intervene there, please, by just reminding champions, because they may not all know, that when we were meeting every week, I passed that information to an internal group, which was the Partnerships, Communities and Engagement group, which you were a member of, and also Gary from Health Watch. And this group has evolved from that, if you like. It's got the same people. So I shared information and intelligence that people gave to me, and that helped our communications team to shape the communications. And we looked at lots of pieces of work like myth busting and how we went about that, and what information was really important to you and how to share that. So we've been doing that all along. But now, as COVID is dropping off and our meetings are getting less and less, we actually still want your involvement, if possible, to help us shape the work in Wakefield and make sure we get our communications right and involve all the people, and we're equitable about doing that. So we would very much like to keep you involved.
That's lovely. Thank you, Tracy. And in a similar but slightly different vein, another thing that is happening, and there is a lot happening around involvement in the Health and Care Partnership. One of the things we are looking at is reflecting reflecting lived experience within decision making. So how do we take people's lived experiences, whether they are a carer or a person who lives with a long-term condition or disability, how do we take those experiences and reflect them and use them to influence and inform the conversations around the strategic decision-making table? It's something that NHS England are working on. The title is strategic co-production. However, we are just trying to focus on the aspect that is key on this one as the lived experience. And there is training that is available as part of this work for anyone who wants to get involved. But rather than sending a long booklet of what is all of this about and what can people get out of it or find out more, we are holding a Wakefield specific taster session next Tuesday. If you or somebody you know would like to get involved or just join us to find out more and then make mind up, you are more than welcome. There is a little bit of information on the poster. We can share email, although on the slides when they are circulated, you will see an email for our lovely colleague Tracy, who's organising it. So we would love to, again, hear from people who may wish to get involved. And I think that was my last one, Tracy.
Thank you very much, Dash. And just a question from me, because sometimes our COVID champions, they have their own network of people, and they might not be caring for someone with a long-term condition, but they might have some information, or they might have got feedback from somebody via their own social media. For example, it was because of our COVID champions raising issues about access to GPs generally that we had specific meetings with Colin Spears, the lead GP, and that led to some improvements being made and changes. So if our champions have got things they're not directly involved in but have information about, I think we're wanting to encourage those people to get in touch as well, aren't we, and to share those messages with us.
Absolutely. If there is anything in terms of services, whatever the service is, whether it's health or care, hospital or out of hospital, we would love to hear. And I'm sure colleagues at Healthwatch would say equally the same. Please do let us know what you are experiencing, what you are hearing, whether it's a direct experience or on behalf of somebody else. We are working on, that's another piece of work that we are looking at and we are involved in, which is around experience of care. And all of those comments will be going into that one big pot for us to understand what it is that is happening across our place and what we might need to do. There will be some engagement around primary care that will be coming up soon, so I will bring that into the group and share a bit more detail when we've got plans, if that is again of interest.
That's fabulous, thank you very much. Does anyone have any questions for Darsha? Can't see any hands up, but I don't know where to look on Zoom now. I've got so used to Teams, I'm really sorry. Shout up if you've got a question, pop it in the chat or email it to us after, thank you. So this is my little bit just to let you all know that the Positive Mental Health Network, which I facilitate, has been doing postcards from Wakefield. This was our 4th year. Last year and the year before, sadly, we had to do them all via social media because we weren't out and about. So we're really delighted that we're going to be out and about next week for Mental Health Awareness Week, and the theme is social isolation and loneliness. And we know how devastating that can be. So what we're asking is, we've got a boatload of these blank postcards. We're encouraging groups, individuals, anybody to fill them in, please. Just share a positive message. It might be a message about how you keep yourself mentally well, what you do to support your own mental health and well-being. Might be a motivational quote, or just a message to somebody who might be feeling isolated and lonely, to give them a bit of a boost. Every single library has got a supply of these, and I've got some too, so if you'd like some, please get in touch with me. We will be out in Trinity Walk all next week from, I think it's 11 till 2. We'll be in Castleford, Junction 32 and Castleford Market a couple of days as well. And I'll be collecting them back in. You can send them back into the libraries as well, and we will display them around the district, and we're going to share some of them via Age UK and some other partners with people who have reached out to say they're socially isolated and lonely, so we can send them some of your lovely messages and bits of artwork, because people colour them in and make really creative postcards. We had some singing postcards last year that were spectacular, so anything goes, and we will be showing them at the Art Walk on the 25th of May in the Ridings. If you want any more information, please do let me know, and I'll share that with you. So now, Asif, over to you. Thank you. You're on mute, Asif.
I've gone through half of my presentation already. Well, what I said was thank you, Tracy, for inviting me to the COVID Champions meeting. This is my first engagement with the group, and it will hopefully prove to be very, very useful, because you've got a wide variety of people attending these meetings, and they're spread out over the district. And what I have is something that will appeal to all our residents throughout the district. Just to go back, in November last year, we organized similar events. We organized 11 events around the district, where we had advisors, benefits advisors available, where people, residents could come in and meet them and speak to them face to face. Well, in November, the 11 events, although I couldn't market them so well, because I didn't have the backup from our comms team at that time for various reasons, we still managed to be very successful. We managed to raise around about £480,000 for 187 people who actually did qualify for a rise in their benefits after that conversation with our advisors. And so because of the success, we've been asked to do another round. And so now, starting next Monday until the middle of July, we have a series of 15 events now. And so these events are, again, all around the district. We've developed quite a lot of promotional materials, including a leaflet, and there's a leaflet with a map on the inside as well, dotting where the locations are and the dates and addresses around the map. And so we're doing everything we can to promote, because comms team are supporting me very valiantly this time. And so what we will have is these 15 events that are on your screen at the moment. And I've tried to get a variety of venues. For example, this time round, I've got 2 schools involved. Outwood School, for example, has 2,000 pupils. And so, you know, that should be very popular. And in the other side of the district, I've got Normanton Junior School involved. And in future events, if there are any, we'll get other schools involved as well. But interestingly enough, Tracy, we've got the Mental Health Museum in Pinderfields Hospital as one of the venues as well now. So we're trying to reach various parts of the community as we can. And what we will have at each of these events is advisors from 5 different teams. The teams being the Revenue and Benefits team from Wakefield Council. They're the team that handles matters to do with housing benefits, council tax benefits, and welfare payments to people in emergency need, and a variety of other things. Then we will also have advisors from the Strategic Housing team from Wakefield Council. They're the team that helps people who are in rent arrears with private landlords and mortgage arrears. And also we've got funds available to help people who are finding it difficult to pay their utility bills and telephone bills and things like that as well. So hopefully these 2 teams will cover quite a lot of the issues that are being faced by our local residents at this time. We will also have a team of advisors from the Citizens Advice Bureau. They were very popular in November. A lot of people engaged with those advisors, and CAB raised a lot of money for people. And we will also have people from our team from Wakefield District Housing. So they will all their tenants who come in, social housing tenants who come in. They'll be advising on rent matters and housing benefits, etc., and also on helping people upskill themselves so they can find jobs and so on as well. And then we will have a team from the Department of Works and Pension there as well. What people find is that when people ring up the DWP, they're hanging on the telephone for a very, very long time, and they don't get their queries answered well enough. So we'll have advisors there who can meet them, and the advisors will be hooked onto their platform, and so they'll be able to deal with their inquiry there and then face to face. And that also proved very useful in November, and having those people there. Now, in terms of having those events is fine, but what we need to do is to reach the public to make sure that they're aware of these events, where they are and when they are, and to get as many people as we can coming to these events. So from the central point of view, Wakefield Council and our partners have done as much as we can to promote the whole campaign. For example, I hope you will buy the local newspaper, the Express, on Thursday, tomorrow, because what we've done is we've created a 4-page advert, which is called a wraparound. So when you get your usual Express, there'll be a covering for wraparound of news as well. And so basically what we've done is we've taken the front, the inside page, back and back inside page to promote this campaign. So, several hundred of these, newspapers are sold every week. So hopefully it'll reach their readership. We've also organized some paid advertising in the Express series, and there will be editorials as well and press releases going in there. Apart from that, we've also booked some radio advertising as well on Greatest Hits Radio. So there'll be a month of advertising on that as well. 30-second adverts every few minutes. So there'll be quite a few of them as well. So have a look out for them. Then I've also had a lot of leaflets printed, and I've sent them out to community centers, libraries, and organizations as well. So they've been posted out. Age UK have received some, CAB, and all our partners that I know of, that I have addresses of, they've received all those leaflets come through on Good Friday a few weeks ago. We're also doing quite a lot of e-marketing as well. We've created social media assets as well, some of which are here. So this slide that you're looking at and the slide previous to that as well. So these you can share on your social media, all our partners. As far as possible, please. Let's, kind of post them and forward them wherever we can. And make this event a big success, because the district that we live in is, on the indices, quite low ranked in terms of money situations and poverty and so on. And so any money that comes into local people's pockets, it's good for our economy, and it's good for those people themselves to improve their lives and live a better lifestyle. So that's it from me. I'm also looking forward to doing some campaigning on the road as well. So I've organized 12 events around the district where we engage with public in shopping areas and hand out leaflets to people as well. And so if you can join me in any of those events, I'd be really delighted to see you. We've got T-shirts made with your more money on your pocket on the front. So we'll have a bit of an image, and I'd be happy to receive any support you can give me, please.
That's fantastic. Thank you, Asif. I wish you would have been in charge of postcards from Wakefield publicity.
Well, comms team are being very, very good with me this year.
Wow, note for
Very
next
good.
year. I'm making notes. Maybe we can send some postcards out as well and see if we can get some people to come and support you from the mental health network. That would be lovely.
Yes.
We did have a question, Asif, from Val, asking if any of the events are accessible to deaf people, for example, BSL interpreters.
Last time when we did these events, you know, unfortunately, we didn't have much of a footfall. And so, well, I've made a note that I should, you know, communicate with you more often as well. And what I will do is post you some leaflets because in fact, posting you leaflets might be a little bit too late, because the first event is actually in Outwood, near you, near your office. And it's actually at the Outwood Grange School. And so what I'll do, I'm not sure if I've still got Val's email address, but I'll get it from Tracy and send some material by email at least. So, you know, whatever we can do to support the deaf community, we will.
If you just made 1 or 2 sessions available, at least then we can promote it. There's not much point as promoting if it's not accessible to them.
Yes, Val. Okay, I get the point. And
somewhere central, like Wakefield, Ridings, Castleford, wherever you are there, somewhere central.
Yeah. Well, there is one in in the Ridings, and that one is on a Saturday as well, Saturday the 21st of May. And so, you know, if you can promote that one in your community, that would be great. And if you can come and support us, that would be wonderful.
I was thinking more like having some BSL interpreters available.
Yeah. What I can do, Val, is to arrange a special event for your organization and your membership. How would you like?
That'd be good.
Yeah, that'd be good. And then,
yeah.
And then you can help us yourself with BSL interpreting and so on, or we can.
No, I'm sorry, no, we don't have that experience. We need someone with a level 6 qualification.
Okay. Yeah. Okay. We will arrange that. Yep.
Yep, that would be good.
So I'll communicate with yourself, and we'll arrange a special one after these 15 events. For the deaf community. Is that okay?
Okay, yeah, brilliant.
And then your organization can help us promote that one, and it'll be specific for people with hearing issues.
That's great.
How's that?
Great. Yep, brilliant.
Yep. I'll find your email address, and we'll sort something out for yourselves.
Yeah, Val won't mind me sharing it with you.
No, not at all. Not at all.
Brilliant. Brilliant.
We've also had another comment from somebody, it just says iPhone, so I'm not quite sure who sent that, but it says, can we ask if you will have interpreters for Polish, Russian, Arabic, etc.? So what about other languages?
Thank you very much for that question. We've actually translated the leaflets into Polish and Urdu, and so we will have, I will be posting them out now. The Polish ones have gone out to Marek's organization, and he's going to promote them throughout the Polish community. The Urdu one, I've just sent them out for proof checking, and if they're all okay, then I'll promote those through all the mosques and other organizations that we have. The physical leaflets have already gone out to those organizations. Now, having interpreters in all those languages at each event, unfortunately, is very difficult, and same with BSL. But like I said, we'll organize something specific for the community with hearing issues that we should definitely do. but unfortunately, we don't have interpreters in all those languages at all the events. The events are going to be rather, short, 3-hour events, and we're going to be overwhelmed with visitors this time round. And what people will be doing, the advisors will be doing, is noting down the contact details and the issue that the person has, and resolving them over the next few weeks.
Yeah, so it's not just a one-off, is it, Asif? If people who have extra needs, if you like, want to ask questions and get support, we will ensure that they do that. It might not be at that event, but if people make contact with us, we do have interpreters and ways that we can support those people individually, rather than setting up one event and expecting everybody to come. We will do that individually.
Absolutely so. And we have our community links and so on. So the language interpretation and the message to make sure it reaches our communities will go through our partner organizations. And, the meeting at the events is just a brief meeting to get to know people, to get their contact details, but then there is a usual follow-up, and it takes several weeks to help the people to achieve the benefits that they're entitled to. So it's an ongoing process, and part of the general team's work. So that's their daily work. And so this is just a sort of a additional push to get more people to come in and receive the assistance that they're due.
That's fabulous. Thank you ever so much, Asif. And we've done well this time, because I'm only 6 minutes over. I went wildly over one day. I think we were like an hour instead of 30 minutes. So we've crammed a lot into a small space, but hopefully it's mostly been all good news, I think, this time. And Gary Jevons has just put a note on there to absolutely let Health Watch know if you've got any comments or concerns about health or social care, and he's given his contact details. So we'll make sure that those go out. So unless we've got any more questions or comments.
If there's some people wanting my contact details, and so if you could kindly, Tracy, put out my email and phone number out, then I'll welcome any inquiries to me directly.
I will. In fact, I've just circulated before the meeting, actually, at your request, Asif. I circulated some information that you'd sent, and I'd put your signature at the bottom, so people will have that already via an email, but I'll make sure it goes out again.
Yeah, we do have an event in South Hemsall and Kirby areas. They're all on the list on one of those slides. Yeah,
that's lovely.
Thank you very much.
Thank you very much. So we shall leave the meeting there. Thank you very much for everybody who attends and listens to the information, and please do share that information with other people in your network, and do get in touch if you do have any other questions or comments. You can email me anytime, or you can email ccc@wakefield.gov.uk. Thank you very much. Have a great rest of the week, and see you next time.
Thank you. Bye-bye.
Bye.